All right, welcome back into another week, another podcast of Weather Chat. I am meteorologist Scott Sumner, and of course, I want to bring in Chief Meteorologist Jackie Layer. Hello, Jackie. How are you doing today?
Hey there, Scott. I'm great. Yeah, it feels good outside. Really nice, at least through the last couple of days. And I know this is the time of year. Everyone's talking about it. Pollen. It's
Oh,
everywhere.
absolutely. Coughing, sneezing,
Yep.
all that congestion going on.
hmm
I am very prone to it.
Yes.
And I think a lot of people are every
hmm
couple of times a year at
Yes.
least,
Yeah.
right? You know?
Yeah.
But we're going to break that down a little bit. And with us today, I actually, when I had my old podcast, Jackie,
hmm
I interviewed Dr. Bielory, years ago.
Yeah.
And it was great then. And it'll hopefully be a good, of course it will be. What am I
Great.
talking about? It'll
Of
be a
course.
great interview
Yeah.
once again. How are you today? Leonard, can I call you Leonard too? Is that okay?
They call me Dr. B. It's very easy.
Dr. B. Okay. All right, Dr. B. Well, welcome back. It's been a long time. I hope everything is good with you. How are you doing?
Vertical with a pulse, as they say.
Vertical with a pulse. I love it. Well, I tell you what, your resume, of course, speaks for itself. And just in case people did not see the podcast years ago, I had taken down a couple of notes here. Of course, you're a renowned international expert in the field of allergy and immunology. You have served on the World Allergy Organization's Committee on Climate Change, as well as a committee researching the use of supplemental probiotics for allergic diseases. It doesn't stop there. There's an interesting tie-in here, two tie-ins actually. First of all, you got your medical degree in Rutgers University in New Jersey, and Jackie just so happens, and I are from New Jersey, so
Yes.
both
Home
from
state.
the home state, Garden State. And you have tie-ins to Maryland here, Bethesda, Maryland, fellowship at Hematology National Institutes of Health, National Heart, Lung, and Blood Institute here in Bethesda, Maryland. So, then, thank you for taking a few minutes of your time today and joining us. Um, so today we're going to be talking a little bit about, of course, allergies. And Jackie, you want to start us off here? You had a
Yeah.
couple of
I
questions
know.
here.
Dr. B, thanks again for, sitting in with us today and talking, all things allergies. So what exactly does an allergist and immunologist do, and how is it different from a general physician? Can you explain that?
Number one, it's my pleasure for being on, and thank you for the invitation. An allergist immunologist actually is a multi-systemic individual person who really looks at a variety of conditions from literally head to toe and has no specific organ system, but looks at one final mechanistic process, and that's called inflammation. If it inflames the eye, it's conjunctivitis. The word itis is the term at the end. Rhinitis for the nose, dermatitis for the skin. Asthma should really be an itis, but it's a old Latin term, Greek Latin term derivative, where there's a breathing difficulty due to inflammatory process. And originally, everybody thought it was just a spasm, and the allergist immunology were the first to do the research to further expand the inflammatory nature of it, and therefore leads to advances in the treatment of these conditions. Because if you turn off the quote unquote the inflammatory trigger, whether it's pollen and interfere with the different ways, which I'm sure we'll get into that, or we get into prevention or immunomodulation, changing the immune system. But the bottom line, the allergist is a subspecialist who trains in either pediatrics or internal medicine, as it is a conjoint board. He sees both specialties, meaning both kids and adults, and so all ages. And he looks and examines for whether it is an allergic response or immune response. But the umbrella, the immune response is an umbrella. The allergy response is a subset of the immune response, focusing on mucosal surfaces where you interact with your environment. The pollen affects the eyes, the nose, and perhaps food in the GI tract. But these are the interactions leading to a variety of presentations, which we will go over a little bit through our podcast.
Okay, sounds good. And here people always say, there's something new, or why is it more common, and blah blah blah. So, in answer to that, I came up with a question: was why are allergies becoming more common today, or is that just a myth?
No, it's not a myth. There are two reasons, meaning, for example, the genetic makeup of the human race, if you have one parent who has allergies, you have a 30 to 40% genetic predisposition. Both parents, 60 to 80%, literally. But in the past 50 years, we've actually seen, for example, for every decade, we've seen individuals who have peanut allergies double. And we went from almost nothing to doubling every decade. And so it's not just reproduction because nobody has done that. I mean, live 60 to 80, 90, you should live to 120, so to speak. But there is a prevalence in the environment of individuals changing their immune system and sensitization. In regards to pollen allergies have also increased. It went from 10 to 20%, and now as reported by the American College of Allergy, Asthma, Immunology, self-reported to almost 40% of the U.S. population will state that they have an allergic response to something. The CDC has done a study and showed a change in skin testing positivity that has increased by 30, 40, 50% throughout the country for a variety of allergens as they did this study. Now, that has to do with a variety of different reasons. One is that the truly meteorologists, things have changed. And I don't use the word climate change because that really uses the span of time that could be 100, 200, 500 years. I mean, and the causes are a variety because obviously the ice age occurred and it wasn't due to pollution at the time. But then nonetheless, at this point in time, we are seeing the generation of pollen that starts earlier and ends later. And that led to a research grant that I was a principal investigator by the United States Environmental Protection Agency, where we actually analyzed and did some modeling to predict what would look like in the future based upon the present and the past, because I have data going back almost 60 years of analysis of the pollen release in the United States. And sure enough, and the most very clear study was ragweed release. 3 out of 4 Americans have allergies to ragweed. And that occurs August 15th, plus or minus a week, especially in the Northeast area and in the DC area. And in that regards, you will see if you had put a pollen counting station in Texas, and we did a line from Texas all the way up to Canada. And you will see that it starts earlier and ends later as you move up, as you move north.
Hmm.
So you now have more pollen when in New Jersey and actually in other studies that I've just completed, we're seeing increase in the amount of pollen going up by 10% per year in the past decade. So you're getting trees and more plants producing more pollen. That's one. And two, starting earlier and ending later. So you have more of an exposure in concentration and duration.
Hmm.
And when you have both of those components, you increase sensitization. You get sensitized to it. You're not allergic to pollen if you've never been exposed to it. If you move from Alaska to Washington, D.C., you don't develop symptoms until you're there for about 2 years. So if a state senator comes in from somewhere never having the same pollen exposure, quote unquote, it takes time to develop that sensitization, but you need to be genetically predisposed to do so.
Interesting.
I learned a lot. I was writing down all these stats. This is incredible. Thank you so much, Dr. B. Oh, another question that I hear a lot too, and also I'm curious about, how can I know for sure if my symptoms are caused by pollen or something else like dust or mold?
Well, that really does not make much of a difference. They're
Okay.
all, in that case, the itis, the inflammation that occurs to the eyes and nose, and is caused by the interaction of your immune system of the allergy cell called the mast cell, the IgE antibody, which is attached to the mast cell, and which is when the IgE antibody and the mast cell are attached, the pollen, dust mite, or mold then actually come in contact with that entity in your nose, in your eyes, in your lungs, in your GI tract, and the mast cell will then release. What is a release? Histamine is a chemical that's preformed, and that's why you take an antihistamine. But it releases other chemicals called leukotrienes and prostaglandins. Those are more sensitive to steroids. So therefore, steroid treatment may be required for certain allergic conditions that don't respond to the standard treatment. So in that regards, how do you differentiate the two? Number one, dust is all year round. It's a perennial system. And I think you even hinted that to yourselves. You have multiple bouts of allergies that may occur in different individuals or even in the same individual over the year. That has to do with the seasonality of pollen or tree, or I will say botanical entities releasing their reproductive component of their plant, meaning the pollen is nothing more than the reproductive ability of the plant. It's the male, it's a pollen, it's a sperm, and it goes to the flowers. It looks for the flowers to create the seeds. And the pollen is basically in seasonality. In the Northeast, where you're located, we will see trees first. You have the cherry blossoms going on now, and you don't have ragweed yet. Ragweed will not occur for another 2 months, 3 months. So you really have seasonality. Elm, cedar, maple will occur starting in March and go through the middle of May at that time. And that's why in the next 4 weeks, you're going to find this yellow powder all over your cars. That's
We already
all
do.
tree pollen.
Yep,
We
we
love
we
that.
already have it.
All tree pollen.
Yep, we love that.
However, as the tree pollen is coming down, the grass pollen is going up. They actually overlap. So if a person is allergic to both trees and grasses, the season never ends, so to speak. It's spring. But then they may not be allergic to some of the weeds, and so they get a respite during the summer. And then August 15th, the end of the summer, during quote unquote hay fever season, is neither an allergy to hay nor is it a fever. That's another differentiating point. Allergies rarely cause fever unless you have a secondary infection like sinus problems.
Mhm.
But otherwise, hay fever is allergy to something that is releasing pollen at the time hay is harvested. I grew up on a farm in New Jersey, down in Farmingdale, New Jersey,
Mhm.
and the scenario, I don't have many allergies. That's another issue, very fascinating. People who grow up on farms have less of a chance of having allergies than people in the city. That has to also do with exposure of materials to a variety of entities. So you have seasonality, trees, grasses, then weeds. But in the Northeast, including Washington, D.C., you also get a second grass season that starts in Indian summer. Around,
Mhm.
second September 15th, you will get a secondary release on the Northeast of grass pollen.
Wow, that's a lot
Yeah.
to take in. Matter of fact, what you just said, Dr. B, is we have a couple of graphics we're going to show coming up in the next break. So we're going to take a quick break. We're going to rehash some of that stuff
Mhm.
that you just talked about and have some further questions. So hang tight, and we'll be right back after this commercial break. All right, welcome back to another Weather Chat podcast. And I'm meteorologist Scott Sumner talking again with Dr. B and, of course, Chief Meteorologist Jackie Layer about allergies. And I tell you what, we have got a graphic here. Let me pull that up.
Mhm.
Okay, there we go. And this is the our local allergy forecast. Top allergens, as you were talking before we went to break about the different types. Tree obviously is the main, and we've got maple, juniper, and birch intact here. It looks like pretty extreme or pretty high running through the weekend, but we should have some rain kicking in, so that will help basically kind of maybe squash. Or how much does, okay, I brought up my own point.
Yeah.
How much does the weather, whether it's a thunderstorm or something, squash some of these allergies?
Weather plays a very significant role in the pollen production as well as pollen distribution. Pollen production, for example, you've had a lot of snow this past winter. The reason why you have an increased pollen production this year is because the nutrients from the melting snow, but you had a well-founded amount of snow that will water the plants, so to speak. And so what we found in our research from the US EPA grant is that the prior winter season, depending upon the amount of precipitation and snowfall, increases the amount of pollen in the following season, meaning, and it's mainly the tree season that it hits because you can still have a drought over the summer. So nonetheless, in that regards, the amount of precipitation does play a role in the amount of production. Now, in the day-to-day events, as you just hinted to, if it rains, especially in the morning, and it rains for a period of time that progresses, it will scrub the air and prevent release of pollen for that day until the temperature releases of dryness occurs where the pollen can be released. Pollen is not what is, like I said, the male reproductive component of the plant, and it is windborne and has to be quote unquote ability to fly in the wind. So people are not allergic to tulips, roses, or even though you have something called rose fever. The reason being, to be allergic to flowers, which are pollinated by insects, you would have to snort them. And you would have to snort them frequently because you would need to get them sensitized and be able to be, because those are insect pollen, entomophilous, not versus anemophilous, the type of windborne versus insect pollination techniques.
Very interesting.
Yeah, I didn't know that.
Yeah.
Yeah. I love that we are learning all new things in this podcast today. But also, Dr. B, kind of going along with more so the symptoms associated with allergies. Why do we feel, itchy, congested, or fatigued? Just because you were just talking about, allergies with, different plants and et cetera. But why do we get like that?
Well, that has to do with the chemical release from the allergy cell. And like I said, histamine. Histamine, when it is released, causes is itching, and is a notorious itch. So, if you want an anti-itch medicine, you want an antihistamine. If you want an anti-itch medicine in the skin that doesn't have a hive, you want an anesthetic, actually, because most antihistamines can have anesthetic components, but that would need to be topically applied. Systemic antihistamines for atopic dermatitis eczema is not very good, whereas antihistamines for hives, urticaria, works very, very well. So that is what the itch. The other symptoms is nasal congestion, very stuffy nose. That is not is not totally histamine induced, and that's why most of the medications that you see will say antihistamine D. I'm not going to mention any products, but the scenario there is that the D takes the decongestant, and that is more from the other chemicals, the leukotrienes and other steroid responsive, and therefore steroid-based medications do very well for nasal congestion. And the same thing for the eye. The eyes itch tremendously, and therefore an antihistamine ophthalmic, a drop in the eye, it's incredibly soothing. But for your readers and for yourselves or whatever, whenever you put a medication in the eye, refrigerate it. It is incredibly more soothing to deliver a cooler-based medication into the eye. And here's another little pearl for your readers or your listeners. If they try to get into a child's eye, which is quite difficult, ask the child to close their eyes and bend their head back and put the drop in, quote unquote, up by the nose. And then ask them to open their eyes, and it pours in.
Oh, very good.
I still do that to this day.
Do you
Yes.
really? Hey, could Dr. B, can pollen allergies lead to asthma? That's a question that we've had before.
It is associated, especially in children. 90% of children with asthma have allergies as a trigger. As we get older, the allergies have a less of a trigger, but there's been an increased resurgence of pollen-induced allergy for asthma, as well as allergic responses in chronic obstructive pulmonary disease. These are the smokers. They're using the same type of allergic inflammation may be key in those patients as well.
All right. Good stuff there. And Jackie, you had another one?
Yeah, and I mean, we're still talking about, the symptoms associated with, allergies. What are the most common allergies you see, or I should say, most common, symptoms that you see in patients today, and also the most common allergies, I should say too. So double question there.
Symptoms are anything that's in exposure to the environment. So the symptoms are the ocular surface, itching eyes, tearing, redness. The nasal symptoms are nasal runny nose, sneezing, nasal congestion. But the nose really overrides the eye most of the time because the nose is a vacuum cleaner. You breathe in the pollen, and the eyes are quote unquote a windshield wipers. It doesn't. It's by the pollen impacting. So the concentration of pollen on the nasal surface is more than that on the ocular surface. So that's a difference there. And the scenario is that even though your nasal symptoms are there, when you treat them, you still have the ocular because nasal symptoms, steroids may have an effect on it. And surely um, we use other items. We use a treatment here uh, called sinusol. It's a nasal lavage. It's all holistic essential oils. And it is people, you can use that 10 times a day, whereas steroids and others have a regimented approach. Being essential oils, nasal lavages are great for just washing it out, and as many times as you want in that regards. The congestion, as you suggested before, and the malaise, we talked about, we didn't get to the word malaise, the fatigue associated. People, when you have these chemicals, number one, histamine is a central nervous system effect. And in fact, the most common side effect of antihistamines is sedation. If you look at most of the over-the-counter sleeping pills, they contain an antihistamine, a very strong one, diphenhydramine is the agent that actually causes sleep. And if you use antihistamines long enough, it actually increases weight gain. It stimulates the appetite center.
Mm. Oh, gosh. More good stuff. We're going to have to take a quick break now, but we are going to come back more with Dr. B, and we'll have that in just a few minutes. Stick around for that. Bye-bye. All right, welcome back here, Weather Chat. I've got Jackie Layer, of course, Chief Meteorologist, Dr. B, allergist and an immunologist with us today, talking about pollen and allergies and all those things you just despise out there. But we have a graphic. First of all, we're going to do a little recap here. So you said that there were 3 types of pollen. We're in the tree pollen section, grass, and then weed come in. And Jackie, you have flip the switch if you wouldn't mind going over to the next graphic here. This is a breakdown, and again, you can just click through it a little bit.
Sure.
Right now, we're through tree, high tree, but then you said this is correct. In May, tree pollen starts to go down, but the grass starts to come up, peaking in June, and then grass goes down and weed comes up in September and October. This is pretty accurate then for DC, but not just DC, but for everybody. Is that kind of the thing, or again, it's kind of region by region? You have to know your region well.
It is by region, absolutely. And it's very much so. You're considered part of the Mid-Atlantic Northeast region, and that's pretty consistent. And as you see right there, that's why you have trees first, and you can see even types of trees. They have each tree probably has 2 to 3 weeks, and some trees have 4 to 6 weeks of pollination. Birch and oak are huge. They're the ones that you're seeing now. You're saying now, and you're going to see them even more in the next 4 to 6 weeks. 4 weeks for sure. You're going to have, and as well, understand that birch and oak is probably the most sensitizing, very high concentrations in the thousands. The scenarios that birch, as an interesting, cross-reacts in foods. Pollens and foods cross-react. Cantaloupe cross-reacts with ragweed, chamomile. These are all cross-reactive proteins because you're allergic to proteins, not to sugars or fats. So from the trees and from the grasses, from the weeds, it's a protein component of the pollen that cross-reacts with your immune system, and interactions cause the reaction pattern from the mast cell, the allergy cell, through the IgE antibody.
Yeah, and during this time of year, what can people do at home or, before they go outside to reduce their symptoms aside from, taking medication?
Well, right. Avoidance is number 1. And 2 is that, if you have to, wearing a mask and what time you jog in the morning, if you jog in the morning or afternoon, take the afternoon. Most of the pollen is released in the morning, but there are some pollinators in the afternoon that will need more specific information. And we're working on a research grant right now to examine more real-time pollen counts to assess and provide to the public. This is something we're doing as the Center of Aerobiological Research at Kean University in Union, New Jersey. The scenario here is that you're looking for prevention, and in that regards, a mask does work. I mean, filtration. There was a specialty mask called the pollen and mold mask, but it becomes very hard to do so when you're jogging, when you need to breathe. Respiratory rate has to be increased in the volume of air. So that's not an easy scenario, but it is a preventive medicine. However, if you are severely allergic and you develop asthma, and 8% of asthmatics don't wheeze, they cough, and you have somebody who has coughing spasms,
Hmm.
and it's a spasm, and that's what the lung is undergoing. You can pre-medicate with medications such as albuterol. There's now a combination albuterol with inhaled steroid, which is excellent, and in that regards to develop to decrease the effect, and therefore we use that very commonly for kids who play soccer this time of year, football, baseball, and they get winded. And if you find out the winded is due to their allergies or pulmonary asthma complaints, you pre-medicate 10 to 15 minutes before the event, and they will be good for 2 to 4 hours.
Hmm. All right, very good. I've got a question here for you.
Mhm.
Basically, what are autoimmune diseases and how do they differ from allergies?
As I said, the immune system is the umbrella. Allergy is a subsection of the immune system. And I'll add the type of uh, treatment for going back to the other question before continuing with autoimmunity is that immunotherapy decreases the intensity by 10 to 100 fold. It requires you to be exposed 10 times to 100 times more pollen to develop the reaction pattern. If you go to the gym enough, you can lift 5 pounds and then 50 pounds, then 150 pounds. It develops the tolerance to quote unquote the proteins in the pollen. When it comes to autoimmunity, then autoimmunity means exactly that. Auto, self, immunity. Your body, for some reason, is attacking your own body. In a classic condition, one of them is called Hashimoto's thyroiditis. Itis is inflammation. Thyroiditis means a thyroid. And it's a condition that usually occurs after a viral infection, a sore throat, that inflamed the thyroid, and your body is going after the virus.
Hmm.
And it just so happens to be in the thyroid, and now you have thyroiditis. So that's an immune
Huh.
response to yourself, and that's most commonly associated with an infectious process as the trigger. But there are some immune systems or disorders we don't know why. I remember I always thought systemic lupus erythematosus would always be an infectious disease agent, but we never found it. But it's autoimmune. Rheumatoid arthritis
Hmm.
is an illogical response to your joints, and you get fevers, you get non-specific cutaneous rashes. It's a very diffuse itis. It's itis of your lung, itis of your eyes, itis of skin. It's the inflammation of these target organs, dermatitis, uh, nephritis, kidney. It attacks a variety of organs in the body. Auto attacking yourself.
Hmm.
I learned something about that.
Yeah.
I feel like I keep seeing it popping up in my social media talking about autoimmune disorders that I feel like a lot of more young people are getting for some reason. Is there a way to, prevent an autoimmune, disease or disorder, or is this can happen, to anyone?
Well, it's a genetic. Most immune responses are genetically predisposed. As I
Mm.
said, for like allergies, 30 to 40% of allergic response. If your mother has allergies, and another 30, 40% if your father has it, and your mother may be allergic to cats with hives. Your father is allergic to corn with eczema, atopic dermatitis, and the child has asthma to ragweed. You know, so you don't inherit the specific protein sensitivity, but you inherit the disposition to develop the immune response. The same thing with rheumatoid arthritis, with ankylosing spondylitis, or any of these autoimmune. You may inherit the gene that increases the propensity for you to develop an auto-inflammatory condition. And there are some very rare ones, very strange ones, but nonetheless, it is a genetic predisposition, and it's usually, from many researchers' point of view, triggered by something. And viral infections, like I said, as a model, as a thyroid. And sometimes we just don't know what is causing, but it may have been a viral. I'm seeing a patient now with pericarditis, with effusions in the lung, and it really, nothing's showing up properly. And it's not autoimmune. I just literally saw her this morning, did a whole panel, negative. And other reasons are being still looked at, but it's not autoinflammatory. And she gave a history of having a flu-like syndrome about 2 to 4 weeks before having this. So it may have been triggered by in January, end of January, with this flu-like syndrome.
Hmm. Um, Question, and you might forgive me if this is a repeat, but how much of allergy development is genetic versus environmental?
It's both.
It's both. Okay.
Meaning, it's a fascinating study done on twins, for example. If one they're separated shortly after birth for whatever reason, early in life, one lives on a farm and another one lives in a city. The one who lives on the farm has less allergies, even though it seems like, oh, you're living on a farm, you see the ragweed, you're at hay and all that.
Right.
The more you're exposed to, like I was exposed to on a chicken farm, the more you're exposed to the pollen at an early age, the more you're exposed to endotoxin, a variety, what we call the hygiene hypothesis, which maybe is more of a theorem at this point in time, in which a child is exposed to a variety of items. I mean, people used to be very sterile. I mean, my children, it was a fad to you sterilize the bottles and make sure they don't. Yet the more they're exposed to disorders or diseases like colds as a child, playing outdoors as a child, the less allergies they have in later on life. The more sterile they are early in life, the more likely they have allergies. So environmental vote is key. It definitely it has a role there. The more from the farm to the city, the people in the city have more propensity. But you need the genetic backup. If you have the genetic backup, you have an even more accentuation. The third component of this is pollution. Pollution acts as an adjuvant. It irritates the skin, the eyes, the nose. And when you have it irritated from variety ozone, particulate matter, other things that irritate the mucosal surfaces, the pollen is the inflammation associated pollen is now 3, 4, 6, 10-fold. It increases the inflammatory reaction symptoms associated with it.
Now, is there any hope, Dr. B? Can people outgrow their allergies?
Yes, people do outgrow allergies. They're what we call senescence. Some people don't like the term. It's geriatrics. The type of term we get age. Our immune system can also age, but with age, you can also develop a new allergy. There are certain type of responses that occur later in life, from gluten sensitivity to celiac disease, which may occur earlier on, but may become more intense as we age. But nonetheless, the allergic response overall, if you look at the curve for children, like I said, 90% of asthmatic children have allergies at the trigger. As you get older, the sensitization decreases in a curve from the ages of 20 to 30.
Yeah, I was glad to hear you say just a few moments ago that you want to be susceptible to what's out there and don't hide your children in a bubble, if you will, because over time that will only be a bit detriment to them, as opposed to your own body's immune system fighting stuff off as they would normally do. So, very important stuff there.
That is classic. I mean, in fact, I'll make a comment. If we're watching the TV, if kids are watching the tube, are on TV, computers, they're not outdoors. And that is also associated with you questioned why are we seeing more?
Yeah, no, that's a very, very important point there. We're just about to wrap up here, but I do have one question, the last question here for you. If listeners remember one thing, listeners, watchers, viewers, right? Remember one thing from this particular episode, what do you think it should be?
Allergies are increasing. You can prevent them. You can use holistic treatments or nasal lavage just for nasal items. There are methods to treat the prior. Immunotherapy does improve intolerance over time. And there are pharmacotherapy, but I like to, when I see patients, I try taking them off medications and more holistic approaches, and give them more guidance of how to go through uh, and prevention.
Mm. Actually, that's a good point. Yeah, I was going to end there, but holistic. You hear a lot about the Eastern culture as opposed to our Western culture, and everything from what acupuncture and stuff for healing. Um, there's got to be something to that, right? In all variants of life.
The answer is yes. That's why I was on the committee for probiotics. Probiotics do work, but most of the probiotics you buy over the counter are dead.
Mm.
Over 99% of them. There are only two or three that are really had enough concentration or are alive. I mean, I did a consultation for a company, to a large company, to find out whether there's a market. And probiotics do work, and it's a fascinating area. It's under extensive research, looking at what probiotics may have to in different parts. There are still many bacteria, billions of bacteria in our gut that have been unidentified,
Wow.
and the balance of these bacteria as they become more knowledge, as we become more knowledgeable. There's a mouse model, fascinating mouse model. You kill a certain bacteria, these mice develop joint pains or joint conditions that look like rheumatoid. You reintroduce the bacteria, it dissolves.
Hmm.
So there is a fascinating area of that area. Now, going back to acupuncture, it has an effect. I was a chairman of the Raynaud's treatment trial sponsored by the NIH, and we looked at biofeedback versus calcium channel blockers. Calcium channel blockers worked hands down. However, biofeedback did have an impact in a subset of patients. But again, it's not cost effective and it's not easy to have access.
Hmm.
We use a nasal lavage solution called Sinusol here. It's a product that you can get, it's on the e-commerce various sites, and it's all holistic. It's nasal, it's eucalyptus, menthol, eucalyptus, cinnamon, mint, thymol, camphor. It even has benzoin, the old military medicine for healing surfaces, and dentists use it all the time in their oral hygiene treatments. And it has worked, and it was shown in a recent study to have improved in many of the symptoms associated with nasal allergies.
Jeez, I mean, so much, very informative. I have to say, this has got to be one of the most
Yeah.
informative podcasts
Yes.
we've ever had.
Walking away with a lot of
And
stats. I
a
learned
lot of
about that.
stats, a
Yeah.
lot of good information for the viewers out there, listeners out there. Unbelievable. If we had more time, we could expand upon all of this because we still have another 12 questions here,
I
but we
know.
can't. We're running out of time
Yes.
for this particular podcast. But we'll have to have you back if you can make it. We'd love to have you back
problem.
and talk some more on certain things in allergy related as well as in the immunology
I've,
department.
For example, I'm writing a book called The Medicine of God. It's called Ancient Wisdom Meets Modern Science. So I look at a variety as an example. Why do we have two hemispheres in our brain?
Yeah.
Why do we have two halves of the brain? Did you know birds fly south
Yes.
and
Actually, I
don't
did know
stop?
that. I
They
did
go,
know that.
and how do they do that?
They have their radar, some sort of radar, like
No, they
no.
sleep while flying. One half of the brain sleeps and alternates.
Oh,
And that's how they can continue.
I,
Whales don't drown. Dolphins, the cepheids, they also have hemispheric. They don't drown because they sleep with one half of the brain as the other half.
wow.
So there's a reason why God gave us two half of brains. If you have a stroke on your left side of your head, Broca's area, you lose your speech. You have a stroke in the right side of the brain, you don't lose speech. However, it appears to be like Asperger's, the emotional morality, how you integrate the information you get with the left side of your brain is how you put output. What do you do with it
Hmm.
and how you do with it?
Wow.
That's more the
Fascinating.
right side of your brain.
Fascinating
We could
stuff.
do a whole nother,
A whole nother
session
show.
on
We
that.
need
Yeah.
to bring it up for that. All right, we're going to leave it at that.
Not a problem.
Thank you so much.
Anytime.
We really appreciate your time. Certainly have a wonderful rest of the week.
Yeah.
And guys, don't feel so down. You know what's happening out there. You just have to take action towards that. All right. Well, as always, we end this. God bless. Be well. Stay safe. Have a great one, and we'll talk again next week.